This is a good stepping point to talk about where Oncolytics, the organization that I founded, and we have 280 practices around the country that are members of this organization.
280.
We have quality standards that talk about adherence that you're mentioning now, and the quality standards really are the backbone, or like the recipe on how to truly be a medically integrated service, primarily and solely for the patients, but also adding value back to the practice and the other stakeholders in the space, like payers and state boards of pharmacies and other stakeholders, providing value by looking at the oral therapy model and emphasizing the benefits of having a team focus on that, and with the ultimate goal of delighting the patient as much as possible that's receiving this oral therapy.
Right, right. It really all is about making the patient have the best care,
Exactly.
you know, of course. And because you've got the option of the specialty pharmacy can fill the prescription, or the practice can fill the prescription, right? And kind of what's been happening over the last few years or so with that, and then the integrated, you know, medical pharmacy. How is that going to possibly improve the situation?
Yeah, so having a medically integrated pharmacy team helps the practice be able to go to payers, in an example, that may dictate the distribution model for a prescription, whether or not it can be filled at the practice or whether it has to go outside to a specialty pharmacy. So if a practice can demonstrate the quality and value that I know a medically integrated pharmacy team can, then that payer may be obligated or encouraged to allow that practice to go beyond the first fill. And what I mean by that is, in most times when you prescribe like a CDK4/6 inhibitor, your pharmacy may be able to fill the first fill, but then all subsequent fills need to go out to a specialty pharmacy, dictated by the payer. But what 8 Oncolytics practices have done across the country have worked regionally with payers to demonstrate to them the quality and value, and by showing quality and value, better adherence, right? Medication possession ratios, less side effects, better management of financial toxicities, because we know that these compounds are very expensive. So by wrapping our team around the 4 quality standards of Oncolytics, have provided opportunities that is unprecedented to be able to go beyond the first fill with 11 regional payers and employer groups at these 8 separate practices that are in different states in the country.
Yeah, it makes so much sense.